Picture this. Your cat just crossed that invisible threshold and turned 6 years old. They're still incredibly sharp, still tearing across the living room at 3 a.m., still leaping effortlessly onto the windowsill to watch birds. You bring them into a corporate veterinary clinic here in the U.S. for a routine checkup, a visit you've honestly been putting off for a year. The vet looks them over, says everything seems fine on the surface, then adds those 9 words that change everything. Let's just run a few advanced diagnostic tests to be safe. 3 weeks later, that exact same cat is hiding deep under the bed, terrified of every sudden noise, refusing to eat due to the side effects of sedatives from a biopsy procedure they never actually needed. Meanwhile, you're staring at a $2,500 invoice, crying your eyes out over a minor abnormality that would have likely never touched them, and the version of the happy, peaceful life you had before that single appointment, the warm purring against your chest every night, the absolute trust they placed in you, that version is gone. That story is not rare. It is happening every single day at veterinary clinics across America. My name is Dr. Whiskers. I'm a veterinary specialist focusing on feline biology and aging, and what I look at specifically is how a cat's delicate physiology changes after the age of 5, which is biologically when they enter their middle-aged years, and what that means for how we make medical decisions. In my work, the heartbreaking pattern I keep seeing is this: well-meaning pet parents who walk into a routine appointment with a perfectly healthy companion and come out the other side dealing with a medical nightmare they did not have before the tests began. That pattern has a mechanism. It has a name. And once you understand it, you will never sit in a vet's office the same way again. Here is the number that should stop you cold. Studies estimate that up to 20% of all diagnostic procedures performed in U.S. veterinary clinics every year are completely unnecessary. But here is the part nobody talks about. That percentage climbs sharply after the age of 5, not because older cats are suddenly sicker, but because the pet healthcare system has become highly corporatized. Standard protocols are frequently designed around clinic revenue, rather than the highly sensitive, stress-prone nature of a senior feline. It triggers something called the Cascade Effect. It works like this. One routine blood test finds a tiny, harmless deviation from the standard reference range. That abnormality triggers an ultrasound. The ultrasound recommends a biopsy under general anesthesia. The anesthesia triggers acute kidney injury in a 6-year-old cat. And suddenly, a beloved pet who walked in feeling completely fine is fighting for their life. All started by a test they didn't need. The cascade doesn't start with the surgery. It starts with the very first test. And that is exactly what today is about. Today, I am going to peel back the curtain on the 5 specific medical tests you should never blindly accept for your cat after the age of 5. I'll show you why the risk-to-benefit math changes completely. I'll share what I've seen happen to real patients, and I will hand you the exact home monitoring tools to replace them for free. Stay with me through all 5. Number 3 is the one that surprises people the most, because it involves a routine test that sounds like pure common sense. And make sure you stick around for number 5. It uncovers a highly invasive, multi-$1,000 procedure that puts your senior cat through extreme, unnecessary surgical trauma for a diagnosis that changes absolutely nothing. Before we dive into the countdown, what is your cat's name and how old are they? Drop it in the comments below. I read every single one, and it really helps me know who is part of this pet parent community. Let's expose the first test you should question immediately. The multi-$100 Serum allergy panel for a cat that's scratching or grooming more frequently. When a senior indoor cat begins losing fur or scratching their neck, corporate clinic protocols dictate an immediate recommendation for an expensive environmental blood panel. But here is the cellular reality laboratory companies don't want you to know. As cats age past 5, their immune systems undergo immunosenescence. This causes their blood serum to carry highly erratic levels of immunoglobulin E IgE. When a lab runs a blood panel on a senior cat, these fluctuating antibodies trigger an astronomical rate of false positives, falsely pointing to grass, dust, or chicken. You spend $500 on a printout telling you your indoor cat is allergic to the very air they breathe, leading to unnecessary, lifelong steroid prescriptions that damage their liver and kidneys. Instead of an inaccurate blood draw, the true medical gold standard is completely free and highly strategic: the 8-week elimination diet. Food allergies in older cats are almost always a reaction to a specific, overcopied protein structure they've processed for years. You can bypass the laboratory by transitioning your cat to a strict single-source novel protein, like rabbit or duck, for 8 weeks. This clean protein allows mast cells in the dermal layer to completely degranulate, resetting the skin barrier and resolving the itching without a single needle prick. This brings us to a critical masterclass in navigating modern veterinary medicine: decoding vet speak. When a doctor tells you a test is standard clinic protocol for cats over 5, your parental intuition needs to engage. In the U.S., corporate veterinary medicine relies heavily on automated software prompting overworked doctors to bundle diagnostics based purely on age brackets. The phrase standard protocol is frequently a corporate euphemism designed to maximize client financial value. The next time you hear those words, look the veterinarian in the eye with absolute kindness and ask this precise question: based on my cat's specific individual presentation and daily symptoms at home, why is this specific test medically necessary right this second? If the veterinarian stumbles or struggles to connect the test to an active physical symptom, you are looking at a financial upsell. You have the absolute right to advocate for your pet. A high-integrity veterinarian will welcome this question and happily pivot to a tailored, patient-first approach. Our second test to completely avoid without proper baseline screening is the routine, multi-view full-body radiograph for general behavioral changes. As cats pass age 5, they naturally sleep more or move less. A common clinical reaction is recommending an immediate sequence of full-body X-rays under light sedation. However, the physical stress and forced restraint on a cold metallic table can cause immense muscular strain and severe psychological trauma. At a microscopic level, articular cartilage degrades naturally, leading to feline osteoarthritis, a silent condition affecting up to 90% of cats over 5. As chondrocytes undergo apoptosis and synovial fluid thins, tiny osteophytes form along the spine and hips. You don't need a $1,000 imaging machine to diagnose joint inflammation. You just need to become a master behavioral observer at home. Instead of radiation, run this highly accurate 3-question arthritis quiz right in your living room. The jump hesitation. Does your cat hesitate for a split second before jumping onto the couch or bed? The litter box. Avoidance. Are they urinating right outside the tray? Pet parents mistake this for rebellion, but the high walls of standard litter boxes require deep joint flexion that causes intense pain in arthritic hips. The spiky coat. Is the fur along their lower back or hindquarters unkempt or matted? When spinal inflammation occurs, twisting to groom becomes excruciating. If your cat exhibits even one sign, you can instantly improve 80% of their daily comfort for free. Simply cut a low-profile entry step into their litter box, or place carpeted pet stairs next to their favorite high spots. While tracking skeletal changes, you must master the art of reading food labels. The U.S. commercial pet food landscape is a marketing minefield, using beautiful images to mask dangerous nutritional formulations. As cats age, millions of microscopic filtration units in their kidneys, nephrons, lose efficiency. Chronic kidney disease is the ultimate silent killer of senior indoor cats, and its primary dietary accelerant is excessive inorganic phosphorus. Many expensive premium dry kibbles utilize low-grade bone meal fillers with massive phosphorus concentrations. When excess molecules flood the bloodstream, remaining nephrons hyperfiltrate to excrete them, leading to cellular necrosis and permanent kidney scarring. To protect your cat, check the Guaranteed Analysis panel on the back of the food bag right now. Look past the marketing buzzwords and locate the exact percentage of phosphorus calculated on a dry matter basis. The Senior Cat Dietary Standard: for a cat over 5, aggressively seek out formulas where total phosphorus is strictly below 0.8% or at an absolute maximum 1.0%. If a brand refuses to list the exact phosphorus percentage on their packaging or website, it is an immediate red flag. Change their food. The third test that you should absolutely refuse to perform on an unprepared cat is the standard high-stress routine blood panel taken during a highly agitated clinic visit. We all know the sheer terror that many indoor cats experience when they are pulled from their safe home environment, stuffed into a carrier, and subjected to the sights and sounds of a barking dog lobby. By the time your cat is placed on the examination table, their central nervous system is in a state of absolute, unmitigated catastrophic panic. Inside their brain, the bilateral amygdala structures are firing uncontrollably, sending a massive cascade of neurological signals to the adrenal glands to flood the bloodstream with adrenaline and cortisol. This acute stress response triggers a physiological phenomenon known as transient feline stress hyperglycemia. At a cellular level, the sudden surge of counterregulatory hormones forces the liver to rapidly mobilize glycogen into glucose, causing the blood sugar levels to skyrocket to levels that mimic advanced diabetes. When a stressed blood draw is performed, the lab results will frequently come back showing highly elevated glucose levels and a massive spike in white blood cells known as a stress leukogram. Inexperienced or rushed veterinarians will look at these skewed numbers and immediately recommend expensive, lifelong insulin therapies or aggressive diagnostic investigations for systemic infections. In reality, your cat does not have diabetes or a deadly infection. They were simply terrified out of their mind during the blood draw, which completely invalidated the biological baseline of the test. To prevent this catastrophic diagnostic error, you must utilize the modern chemical relaxation protocol at least 2 hours before you ever leave your house. You should ask your veterinarian for a prescription of a gentle, highly safe, and inexpensive neurological modulator called gabapentin. Administering a small, tailored dose of this medication in a teaspoon of wet food 2 hours before a clinic visit gently dampens the overactivation of the feline amygdala. Your cat will arrive at the clinic in a deeply relaxed, serene state of mind, preventing the adrenaline-induced glucose surge and ensuring that every single marker on their blood panel is a flawless, accurate reflection of their true cellular health. This profound medical stabilization connects beautifully to our second masterclass, which is the Senior Cat Vital Signs Trilogy that you can perform completely for free within your own home. Instead of paying hundreds of dollars for diagnostic screenings every few months, you can become the ultimate guardian of your cat's longevity by tracking 3 simple home metrics. The first tool is the specialized skin turgor test, which serves as your early warning system for systemic dehydration and underlying renal decline. Gently lift the loose skin directly between your cat's shoulder blades into a small tent structure, and then release it while counting the exact fraction of a second it takes to snap completely flat. In a perfectly hydrated cat with highly elastic subcutaneous tissue, the skin will instantly snap back into place in less than 1 second. If the skin tent lingers, folds slowly, or takes several seconds to return to normal, it means your cat's body is experiencing a severe intracellular fluid deficit. This is your direct cue that their kidneys may be struggling to concentrate urine properly, long before a routine blood test would show a permanent elevation in creatinine. The second tool in your home medical arsenal is the comprehensive litter box audit, which requires you to look closely at the exact physical volume of your cat's waste. If your cat consumes a predominantly dry kibble diet and you suddenly begin to scoop out urine clumps that are consistently the size of a large grapefruit, your alarm bells should ring. When feline nephrons begin to fail, or when the pancreas struggles to regulate insulin, the body forces the cat to drink massive volumes of water to flush out metabolic toxins, creating massive urine output. Catching these large clumps in the litter box allows you to detect early-stage diabetes or renal insufficiency months before physical muscle wasting or clinical illness sets in. The third and perhaps most life-saving home metric is tracking your cat's sleeping respiratory rate to screen for hidden cardiovascular disease. Hypertrophic cardiomyopathy is an incredibly common silent genetic killer in aging American cats, where the muscular walls of the heart thicken over time, leading to congestive heart failure. While your cat is in a deep, peaceful sleep away from any heat sources, count the number of times their chest rises and falls over a single 60-second period. A healthy cat should always maintain a sleeping respiratory rate well below 30 breaths per minute, typically resting between 16 and 25. If you notice that your cat's sleeping breath rate is consistently climbing past 30 or 35 breaths per minute, their heart is struggling to pump blood efficiently, causing fluid to slowly accumulate in their lungs. By catching this subtle elevation at home, you can bring your cat to a veterinary cardiologist for a targeted echocardiogram and initiate life-saving medications before a catastrophic fatal heart failure event occurs. The fourth test you must never blindly accept for a senior cat is an aggressive, invasive urinary tract culture or exploratory cystoscopy without a basic urinalysis first. Many aging cats will occasionally display signs of lower urinary tract discomfort, such as straining in the litter box or licking their lower abdomen due to localized inflammation. The standard corporate response is frequently to recommend an immediate, expensive urinary culture or highly invasive internal imaging to search for structural bladder defects. But the unique cellular anatomy of the feline bladder tells a completely different story about why these issues occur in indoor American households. The internal lumen of a cat's bladder is protected by a microscopic, highly specialized shield known as the glycosaminoglycan layer, or the GAG layer for short. This thin layer acts exactly like a non-stick coating, preventing harsh metabolic waste products and highly concentrated urine acids from ever touching the sensitive epithelial cells underneath. In indoor cats over the age of 5, chronic environmental stressors such as ambient noise, household changes, or subtle territorial conflicts trigger a continuous release of stress hormones from the brain. These stress hormones directly break down the protective GAG layer, allowing acidic urine to directly burn the unprotected bladder tissue, a sterile condition known as feline idiopathic cystitis. There are absolutely no bacteria involved in this condition, meaning an expensive invasive bacterial culture will come back completely negative 95% of the time. You are paying hundreds of dollars to look for an infection that does not exist, while the true culprit is a completely sterile, stress-induced breakdown of the bladder's internal shield. Instead of paying for expensive diagnostic cultures, you should focus your resources on environmental enrichment and advanced hydration strategies to naturally dilute their urine. Transitioning your cat from dry food to a high-moisture commercial wet food or a balanced raw diet instantly doubles their daily water intake. This extra fluid lowers the specific gravity of their urine, making it far less irritating to the bladder wall and allowing the delicate GAG layer to naturally regenerate without medical intervention. This brings us to a highly critical financial warning that every single pet parent in the United States needs to hear, which I call the pet insurance hack. The vast majority of modern cat parents have wisely invested in premium pet insurance policies through major providers like Trupanion, Pumpkin, or Lemonade to protect against catastrophic medical bills. However, there is a dark operational reality within the insurance industry regarding pre-existing conditions that can completely ruin your coverage. When you bring your older cat to the clinic for a minor temporary issue, such as an occasional bout of vomiting from a swallowed hairball, look very closely at what the veterinarian writes down. If the veterinarian notes a tentative diagnosis like suspected gastrointestinal disease or provisional inflammatory bowel disease just to justify an expensive diagnostic test, your insurance coverage is in immediate jeopardy. The next time your insurance policy undergoes an annual review, the underwriting team will scan those clinical notes with a fine-toothed comb. If your cat develops a genuine severe intestinal illness 2 years down the line, the insurance company will point directly to that old, vague note in the medical record. They will categorize the new illness as a pre-existing condition and completely deny thousands of dollars in legitimate claims, leaving you financially stranded. To protect yourself from this devastating trap, always demand to review your cat's exact clinical chart notes before you leave the building. Ensure that the veterinarian records temporary symptoms as exactly what they are, a simple isolated incident of hairball gastritis, rather than using broad, sweeping chronic disease terms. The fifth and final test that you should never accept for your cat after age 5 is a routine, highly invasive, exploratory endoscopic biopsy for occasional digestive shifts. As our cats age, their gastrointestinal tracts can become slightly more sensitive to certain food formulations, resulting in occasional soft stool or an intermittent bout of vomiting. A very frequent clinical recommendation is to schedule a highly expensive, deeply invasive upper and lower GI endoscopy under full general anesthesia to gather tissue samples of the intestinal lining. While an intestinal biopsy sounds highly scientific and definitive, the physical and cellular cost to a senior cat can be absolutely immense. General anesthesia poses a significantly higher risk to cats over the age of 5 due to the natural age-related decline in hepatic and renal clearance pathways. Furthermore, the microscopic architecture of the feline gut is incredibly dynamic and sensitive to localized inflammation, meaning a tiny tissue sample can look highly abnormal simply due to a temporary dietary indiscretion. You risk your cat's life under prolonged anesthesia and spend thousands of dollars on a procedure that frequently yields a highly ambiguous result that does not change the core treatment plan. Instead of leaping into an invasive surgical suite, the smartest medical alternative is to implement a highly systematic, non-invasive gut restoration protocol. You can completely rebuild the cellular integrity of your cat's digestive tract by introducing a high-potency, species-specific probiotic regimen combined with highly soluble prebiotic fibers like organic pumpkin puree. This natural approach feeds the beneficial enterocytes lining the villi of the small intestine, reducing local inflammation and restoring optimal nutrient absorption without a single incision. By understanding the true cellular biology of your senior cat and learning how to communicate effectively with your veterinarian, you can completely bypass these 5 unnecessary diagnostic traps. You will save thousands of dollars in unnecessary medical fees, protect your cat from immense psychological and physical trauma, and provide them with the peaceful, healthy, and incredibly long life they truly deserve. Caring for and protecting your cat as they cross into their middle-aged years requires deep understanding, patience, and absolute vigilance when making medical decisions. Don't let a lack of information turn a routine checkup into a physical and emotional nightmare for both you and your 4-legged companion. Subscribe to the channel right now to stay updated with actionable, science-backed insights on feline biology and aging. By joining our pet parent community, you will proactively recognize and catch early warning signs right in your living room using completely free home monitoring tools. Save thousands of dollars in unnecessary veterinary fees by learning exactly how to decode vet speak and bypass predatory corporate protocols. Prevent needless trauma and risks to your cat's physical and psychological well-being, preserving the peaceful, happy life you built together. Hit that subscribe button and turn on notifications to ensure your beloved pet enjoys the healthy, comfortable, and incredibly long life they truly deserve. This content is for educational and informational purposes only and does not substitute for professional veterinary advice, diagnosis, or treatment. Always consult with your trusted veterinarian regarding your pet's specific medical condition